So we're going to go through this MRI. This is one of our patient MRIs here. He came in today. He injured himself at work. This is his left knee, femur, tibia. A few fibers of the Axial are present right there. Some soft tissue swelling is right here. Now let's go back to the history. So we have a 50-year-old patient, misstepped, awkward, sort of forceful plant on his left leg. Felt a lot of pain right away and swelling, and he had difficulty ambulating. Okay, there was no pop. Once again, 50-year-old guy, downward force on the knee after a misstep. And this is what his MRI looks like. He was sent to physical therapy for a long time because they thought he'd be fine. Femur, tibia, medial compartment, lateral compartment, medial meniscus right there, lateral meniscus right there. What you see immediately is a swelling right over here in the bone. This is called bone marrow edema. Bone marrow edema of the tibial metaphysis right at the joint. And if we scroll a little bit, we also see a little swelling of the medial femoral condyle. So what happened here? And just at this point, we already know something happened. What happened was it's probably a nutcracker effect, boom, like this, where the knee went like this. So medial compartment went boom, like this, and that led to the bone marrow edema. But usually the meniscus is able to displace some of that energy so that you don't get the contact. So why did it happen? Well, when we look at the back of the knee, we're now at the back of the knee. Let me go back to the front of the knee to give people perspective. The front of the knee, back of the knee, okay? So back of the knee, right here is a space. This is the root of the meniscus, and then we have a tear right there, and then the rest of the meniscus is over there. It's extruded, so this meniscus tore from the root, displaced, extruded that way, and that gave room for the bone to hit the other bone, and you ended up with bone marrow edema. So this is a big problem. The patient has a root tear of the medial meniscus, and this is how you identify it. Okay, so you look at the MRI. If anybody is suspicious of it, and you should be suspicious if you have a 50-year-old that planted their leg and they have a lot of pain. Once again, you go to the back. You go to the back, and you look for the gap. That's the gap. Go to the back, look for the gap, and that is basically the sign of a root tear. Now let's go to the side view over here. This is the sagittal view. Okay, side view of the knee. Let's go to the lateral side. Lateral side is right here. Fibula, lateral tibial condyle, lateral femoral condyle, patella tendon, popliteus right there. Now we go in, lateral meniscus, some cartilage damage right there, some minor stuff, nothing major. A little bit of a bruise right over here as well. And then we head inward. ACL's intact. PCL's intact. Okay, now this is where the money's at right here. Once you hit the PCL, that's where the root is at, and you see a nubbin right there, which is where it's supposed to be. But then it gets a little fuzzy, and then it disappears, and then it comes back. See? So go to the PCL. That's the attachment. So there's a little nubbin that was left over. Go in. It starts to disappear. It's gone, and it's back. So it's like a phantom meniscus sign. That's what we call this, or disappearing meniscus sign. But basically, it's a classic for a root tear. Once again, it's there, it's gone, it's back. Okay? So whenever once again, history, 50-year-old person, axial force, downward, a lot of pain afterwards. And if their x-ray doesn't show much arthritis, sometimes it does, then high likelihood root tear. You go to once again, coronal view, go to the back, look for the gap. Sagittal view, look for the phantom meniscus sign, and if you see bone marrow edema, once again, it pretty much points towards a root tear. So that's how you identify a root tear on an MRI, and a little bit of history behind it. These tears have to be, well, they tend to be operated on so that you can reestablish integrity of the meniscus. Otherwise, the patient is going to end up with arthritis in the next couple of years. Thank you.